Good night, Dorian. Can you hear me clearly?
Good night. Yes, I can.
Okay. Tonight is raining here in La Paz, so let's wait a little bit because I think maybe
Okay.
my device, my internet connection could fail.
Oh, okay.
Yes, on the other hand, well, we are together alone, yeah. So let's wait to your classmates around 10 minutes, okay?
Okay. No worry.
Okay. Okay, thank you. I'll be back, okay?
Okay.
Okay, guys, I'm sorry for this delay. At this point, I got some troubles with my internet connection when the slides are uploaded. So please give me a couple of minutes to solve the situation and then we can start, okay?
Okay, doctor.
Okay, let me see. Can you hear me now? So, okay, let's start and cross fingers because, well, here's still raining and, well, I hope it works. Well, as you know, this is the last week we got on classes. And well, I sent you the slides from this class and next class in order to start studying and catching vocabulary. And of course, preparing homework file and getting ready for the final test. Because it's important, right? Tonight we are going to check the physical exam, the mental state examination, in order to ask questions properly, the correct expressions, I mean. And then we are going to explain diagnosis and management with correct expressions, or the most common ways to give this kind of news, or the way to expect how patients would act when receiving this. Of course, we are going to discuss treatment with patients, and a topic that I think it's important because it's a very common situation that sometimes we don't consider while the medical practice, how to give bad news. Which one is the correct process in order to emphasize solutions instead of the trouble, okay? Instead of the bad health situation could be. Of course, we got some protocols, so we're going to check one of them. That's the most important in my opinion. About the physical exam, we all know this is the basis of our medical job, of our profession. In that way, we know that physical exam is coming from the ancient times, I mean. Okay, we got through the time how it's going to change in according to the technology we are acquiring, how the knowledge is going on for improving these techniques, these maneuvers. Instead of being with our patients like this or naked one, or touching patients that are potentially infected, we got some activities that protect us as doctors and then get a better resolution of that situations. That's why when we examine a patient, when we take these kind of activities, we must follow some steps to catch the patient confidence and then make it possible in a better way. I mean, at the beginning, we must introduce yourself. We must introduce our job or who we are, okay? If necessary, sometimes patients certainly know who we are, and that's not as important as to do it, or maybe we got on confidence because of a previous situation, who knows. But when you introduce yourself, of course, you use expressions like this, good morning, and I am Dr. Mason in this case, or I am Dr. Garcia, or details like that, that is showing that you are empowered on how you make your job, okay? When you finish your introduction, you ask the patient in a brief way what he or she is expecting. I mean, in a clear and simple way. You may use these expressions. Do you know what we are going to do this morning, this afternoon, this night? Of course, do you know what we are going to do? It's very important because if patients, for example, are from Highlands, from a different place from the city or from another culture, and there are places that the husband is the only one that talks and women are not allowed. Sometimes, well, it's not the best way, but we should be clear on this. Do you know what we are going to do? Do you know how I'm going to evaluate you, maybe? Or another expression, I'm going to examine for example, your abdomen, so I can find what's causing this pain, could be an example, right? We also can say, what we are going to do today is, or what we do is, or what happens is that, and then we start doing the medical exam. But we must ensure that patients are ready. Are you ready? Are you okay? Okay, according to these questions, it's easily to break the ice in communication and then focus on the best way to do it. We instruct the patient in a clear but polite manner. I mean, we give instructions, we give the way to get on position, to wait to sit, to get on bed or something like that, okay? In a very polite way, in order to break the ice properly and catch confidence and make our job in the best way it's gonna be done. Of course, we must show sensitivity to the patient's needs and respond to discomfort. Okay, we must be clear on this. If patients don't feel confident and they cannot talk about discomfort, it's not going to be possible to work properly. We can say, previously applying the maneuver, you might feel a little bit of discomfort. This might hurt a little bit, but I'll be quick. Or another way, tell me if it hurts. When we develop palpation on abdomen and that's an appendicitis, of course it hurts. But we certainly need the patient's answer, but that's the way we should ask for this answer in the best way, and it's going to be in a better way, right? Or maybe another expression, let me know if it's sore. I'll be over very quickly. I won't take long. You are doing very well. You're doing very well. This last expression is showing us that we should encourage patients during the physical exam, especially with elderlies and kids. By experience, I'm telling you that, because you encourage them, they feel confident, and it's easily to develop our job and maybe practice more maneuvers to find the correct diagnosis. Then we should talk to the patient through the procedure. While I'm developing the maneuvers, I'm going to explain how it is going on. I mean, I'm just going to, maybe if we got a scalp, okay, an injury that certainly needs a suture, we can say, I'm just going to clean it up properly, to wash with some solutions. First, I'll use, I don't know, I'll use iodine, and then I'll cover with some gauze to get it, I don't know, to get it dry. Now I'm going to apply the anesthesia, the local anesthesia. You'll feel a little bit hot, and then you're going to be without pain. When it's over, I'll finish, or that's it, all over, well, expressions for showing all the procedure while developing this. That's the best way to continue with the correct confidence of the patient, okay? Share your findings with the patient, of course. You must give them the explanation. And you can say, well, I'm fairly certain you've got a, for example, you got appendicitis, that's why you should stay in the hospital for the treatment. Or one possibility is it could be what we call, and then we give the diagnosis. Or I haven't found anything to suggest any troubles, any problems. It's very common situations in the ER room, because we got some patients that just go for receiving attention. Okay, we have to be so polite. We have to develop our job. We can close the appointment with this sentence. I haven't found anything to suggest any problems. You can come back if you feel something wrong. It could be an expression to help you to be free from these situations. About giving instructions, when you're examining a patient, of course we use polite forms that are often used for initial instructions. I mean, could you bend forward as far as you can? Could be one. Or if you could, the auxiliary code, okay? If you could cross your arms in front of your chest, okay? Or another way, what I'd like to do is, what I'd like to do is examine your standing up. That expressions, given instructions, have to be clear, short, without rounding ideas, without repeating extra information. and without giving the objective of them. Why not? If we give the objective of a movement or a position, patients infer that what the situation is going on and change the result, same as in Spanish, of course. After that direct instruction, we must use stand with your feet together. You know, it's a polite instruction. It's going to the point without confusion. Or lie perfectly still, for example. You catch the idea, right? To give soften an instruction, to make it soften, make a question. Can you just turn it to the side again, please? Could you just lie on the couch, please? Could be a way to do it. And in these pictures, you get lots of instructions, the most common instructions, the most common ones in order to practice, to memorize. You got them in the homework file, but now you got on the answers. Practice on them, please. Check all of this, try to memorize it, okay? Because it's important. For example, let your wrist go floppy without energy. Make it fall down, for example. Or maybe look at something or look straight ahead, could be. Or follow my fingertip, could be a neurological evaluation, right? Another one could be curl up like this, or do this and then use this movement to, or use the movement to make the patient copy that movement. This an instruction especially useful for kids. Okay, or number one, relax, or show me what movements you can manage, could be, or a common one, tell me if it hurts, of course, right? Please give me a minute. Okay, thank you, I'm back. I went to pick up my baby, she was crying. About the mental state examination, we must consider that, of course, we got some mental disorders, mental situations that we were checking on Model 1. And all of them require a specific and extra questions based on empathy, okay? That basis on empathy is gonna be the way to get confidence and make it easier. For example, symptoms of psychiatric disorders that, of course, are important to take in account and to consider during the speech with the patient, with all of our patients, are this list, the basic ones. Delusion, dementia, disorientation, hallucinations, illusions, obsessional. Considering all of them, thinking on them, we can realize sometimes that patients are not always thinking properly or making the best way in the mental state. And that's the way we should properly correct these situations. For example, dementia, we know, is a significant mental deterioration due to physical changes in the brain. Or illusions are misinterpretations of real stimuli. Taking these ideas in account, we got on this concept, the mood. We must take it, we must consider this. When describe a patient's mood, it's better to use the patient's own words, okay? We don't have to give them ideas to get this way to describe how they feel. And usually patients give us this kind of expressions. Following anxiety, they can tell us, I feel agitated, restless, anxious, worried, wound up, and panicky, frightened, tense. For example, I've been feeling very low, could be thinking on depression. They also could say sad, depressed, dejected, unhappy, miserable. All of these descriptions about mood, about patient's mood, show us that it's a very wide, it's a very big range, a very wide kind of ideas to describe these mental states. So when we evaluate expressions from patients, they can use some adjectives to describe their conditions. For example, I get very confused about time. I cannot remember what day it is, could be. People make me angry. They are so irritating. I'm too embarrassed to my appearance to go out. I stay at home. Or I get madless when I'm shopping. I go out for milk and I come back with cheese. So another way to receive this information, as I was telling you, are adjectives. Please take them in count. This chart is just the mood meter. It helps us to define how patients can find properly how they feel at the moment. They can consider energy and feeling. And following how they certainly feel, being so sincere, we can point on a feeling, and then it's easier to catch the best way to talk with the patient and make it objective. Just extra information for showing you a new chart. And the most typical questions, the common ones about mental state exam, are this. Can you describe your mood at the moment? How long have you been feeling like this? Do you take pleasure in anything? How are your energy levels? What's your appetite like? Have you noticed any change in your weight? How are you sleeping? Can you keep your mind on things? What do you feel the future holds for you? Have you ever felt that you don't want to go on? Or maybe have you ever thought of suicide? If we translate it to Spanish, we realize that they are almost the same, and we must consider them for starting the speech. If we get in confidence and it's possible, we can focus again the speech and then try to find what is going on, certainly with the patient, right? When we must explain and give diagnosis, and we must talk about treatment, we know we have to be so clear. We shouldn't try to give patients false ideas or false concepts or a confusing definition of the situation. That's why we use this kind of expressions. Talking about diagnosis, I mean the identification of the disease from signs and symptoms. You can start the speech with these expressions. You are suffering from, you've developed, this is why, or you have, or this is mainly because, or this is because. As you know, you're introducing the idea, you're introducing the diagnosis in the technical term, in the medical term, and then patients certainly receive the information, stay quiet, don't ask at the beginning, and you can continue with the management management plan. Of course, taking into account investigations if they are necessary and the first steps on treatment. If you certainly need to refer the patient, you can say, I'll make an appointment with, or maybe with the medication. I'm going to start you on medication too. Or if you prefer and the patient certainly needs, I'm going to have you admitted to, okay. Or I'll arrange for you to, if the patient has the option to go in another moment to someone else, or receive treatment, you'll be given or given an advice. Then my advice, or I'll expect you'll have. Taking into account these expressions, you get a chance to give the information without rounding, without giving an extra idea that could be misinterpreted, okay? About the general advice about changes in lifestyle. For example, giving up smoking or drinking less alcohol. You can say the nurse will give you advice on. Why the nurse? Because we were checking in previous classes that nurses has this hard function to explain promotion, prevention, right? Or we can give, as doctors, give this expression. You should try to give up, then continue. Or I want you to stop smoking, for example. Or it's important that you stay quiet smoking or stop smoking, okay? About the prognosis, of course, we know that sometimes it's not as easy to talk about it, but we have to do it. We can say, I expect the treatment will, I expect, diabetes, for example. I expect the treatment will control your sugar levels and then your symptoms are gonna go back. So let's wait and be patient. Or maybe, hopefully we can get into the surgical room because an appendicitis cannot wait for long. Okay. Or maybe we can never be absolutely certain about the causes of ADHD, but we certainly know it requires treatment, right? Or, in my opinion, an expression that sometimes it's not the best at the moment. You should remain optimistic. You got a treatment, you should remain optimistic. Don't worry about it. Okay, well, finishing giving the prognosis. This is the question time. A hard one. Why a hard one? Because patient has the opportunity to make questions about the situation is suffering from. We open that moment, telling the patient, do you have any questions? And then the patient has the chance to start his speech, has a chance to start giving us the idea and giving us the proper explanation about how they feel. Or you might say, if patients are not in that position to ask, is there anything you'd like to ask? Is there anything you'd like to know about it? Okay, take it in count. Using lay terms in explanations, of course, always. If we use medical jargon all the time, patients are not going to understand us, and that's a fact why patients lost confidence from us. The medical jargon could be interesting and nice for us because we are doctors, but talking that way with a patient, they are going to tell you that you are talking in advanced Japanese. They cannot understand anything because of the meanings. We talk by ideas. We don't talk by short words. For example, if I told you, if we give the diagnosis about a migraine, we are not giving just explaining a migraine. When you hear migraine, you are realizing a situation, right? Not in a specific word with a big meaning, with big troubles that are attached to this diagnosis, okay? That's why jargon between colleagues, lay terms, common terms with patients, in the way they knowledge allow them to catch the information, okay? We must find the way that patients understand our expressions. That's why we got this chart with medical conditions, the name of these situations in medical terms, and we got the lay term, how patients understood the situation and how they are going to explain their families. If you tell a patient acute cerebrovascular event, they die, they cannot understand because they don't have the obligation to know that the cerebrovascular event is a huge process with lot of biochemical answers and physiopathological processes. Just give them stroke. Your father has suffered a stroke, enough. Or what about dyspnea? Dyspnea is a medical term. How you could explain dyspnea using the terms? Very easy. That difficulty about breathing, maybe because of trouble in lungs or heart, or maybe a combination. Easier, your breathlessness. Okay, they understand because they are suffering from that situation. Then we got insomnia. When you say insomnia, now it's almost socialized, the process, and they think that the insomnia is just stay in bed without movement, without open eyes, without talking. Well, but certainly we know that insomnia remains too much, too many situations to take in account to be considered, right? Or what about myocardial infarction? It's better to say heart attack. Or your father suffered a heart attack, go to the hospital. Oh, okay, they run because they understand. About medication or situations that require a specific medication, we use the same idea. We don't talk about, well, we don't talk in biochemical terms or medical terms. We use lay terms. It's easier. It's fine to do it in that way. Instead of saying analgesics, we say painkillers, right? Or same, instead of taking diuretics, we say water tablets. Or we give an explanation about the job that certainly the medication does. For example, a bronchodilator is a substance which causes the airways to open up. That's the best way. Common terms, lay terms, in the words and expressions that patients may catch the information. Or the oral contraceptives, the pill, easier, very common. Even in English, we use that term. We also give simple definitions. We don't make a mess explaining medical terms, and with those medical terms, we don't have the obligation to certainly explain in detail, or as we say in Spanish, with chubis, how these structures work. We can say, for example, for arteries, tubes which carry blood around the body. They realize we have arteries and veins, but ask for an architect, for example, how to define an artery. They are not going to find the best way as doctors, okay? or maybe about the pancreas. It's a gland that helps digestion and makes insulin to control blood sugar. If you tell to a patient, it's gonna say, huh? What? Patients may say that situations that the pancreas is an organ that gets free insulin and that's enough, and they certainly don't know how it certainly works. So please check this chart. It's gonna be on the test, the final test, okay? Well, when we give an explanation of angina, well, ask for this to a driver. He's gonna say that he got chest pain, swelling, and lots of troubles with while driving and talking, and that's the reason why he crashed. Okay, that could be an explanation from a Lego, from someone who's without studies in the medical branches. In this chart, I'm showing you how to explain a heart attack, how to give this process, how to let it be known, and well, patients must consider that the way we talk is the way we work. If I talk in a very easy way, my job is easy, is confident. I might show that it's possible to make without trouble. But if I make a mess while making an explanation, well, patience, it happens. Please read this chart and catch vocabulary. Tomorrow I'm gonna ask about it. And now let's discuss the treatment, one of the best ways at this point. We as doctors, well, we don't have the option to give a treatment, and patients do not have the option to accept it or decline it as a first step. They get the chance to give us the answer in the way they consider it would be better. We give advices, just that, and patients take decisions. That are treatments properly said. Advices and decisions that, well, they are because of them. My advice for you is to get operated, because this appendicitis could be wrong, could be in a wrong way, and then it's gonna be a risk of life. Or my advice is to start taking medication because your situation requires it. We might say that it's a very easy job, but certainly it's not. And we don't have the chance to give just one option. We have to look for 3, 4, or 5 options. Following that ideas, patients got the best way to decide. In my opinion, it's better to give just 2 options. And according to that 2 options, it's going to be possible to make a best job. Advising a course of action, I mean advising about a procedure we must develop. We can say, some time of work might help. If you felt that would be helpful, you could take a week off and see how you felt after that. Could be. I'm telling the patient, take a I'm sorry, my device are failing screen. Okay, let's continue. Okay. Other expressions, for example, other things might help, like raising the head of your bed. For example, we give some ideas to continue treatment to reach the best option for our patient. We must take it in count. Or we can say that's one of the simple things we could start to you off with, okay? Or maybe you said you have not tried indigestion remedies. Maybe it's the way it works, right? Or that's something you could try. Sometimes patients give us a solution, and we only have to hear from them. We only have to pay attention on their ideas, and maybe it works in a better way. About giving ideas or expressions about avoiding something, yeah, we as doctors could say, cut out fatty foods, cut out drinking soda, for example. Or maybe there are a few things about your lifestyle we could address. Perhaps cut down on the amount you are drinking, giving up smoking would help. Okay, as you can notice, we are using phrasal verbs. Phrasal verbs are easier to understand, are easier to get into context, and well, very, very useful, right? Or we can use expressions like this. You should try to avoid tight clothing, okay? Or sitting in dim armchairs or bending, especially after meals or something like that. You should try to avoid using high heels, for example, for the whole week, maybe, right? About warnings, we always give warnings because we must be clear that our first activity as doctors is to give preventative activities. Okay. When we want to warn about the consequence of ignoring the advice, and that consequence would be serious, we can say, if you are not feeling better in 7 to 14 days, you really must come back and see me again. If you don't feel well taking this medication, come back in 3 days. It's important to evaluate it again, could be. If you keep damaging it, you're going to end up with a long-term problem. For example, if you keep damaging your eyes using the cell phone the whole day, you are going to end up with a long-term problem, maybe with visual disorders, maybe with a visual trouble, right? It's very important you don't stop taking the tablet suddenly, or your symptoms will return. For example, in epilepsy, if you stop taking your medication, the seizures might come back. Okay, or if you feel that things are not settling, aren't getting back to normal, it's important that you see me again. If you feel that it's not working, come back without any trouble. There are some expressions so useful, right? About giving bad news, of course, we have lots of of protocols, of principles to follow, of ideas to reach, and then following the ideas is easier for us to. It's not the best way to do it, of course. Nobody help us how to do it. Nobody give us the correct or the proper ideas or the proper process to do it. During the med school, I've never got a class doing this, but I had an amazing professor who taught me how to do it while practicing. He just gave me the medical history. He gave me 20 minutes to read the information, and then he told me, go to the patient and tell him that he's not going to walk again because the tumor he has on the spinal cord is not possible to operate. Go. You are my resident now. You have the chance to do it, to give this information. Just be clear on the information. Don't be nervous. I'm with you. That was his expression, and I ran mad because I didn't know how to start. When I saw the patient, he was expecting that miracle about walking again because, well, he was losing his capability of walking through the time with pain. He got a spinal cord tumor that was possible to check in the MRI, but not possible to check in the CT scan or other imaging studies. It was a consequence of cancer, and well, it was not a very comfortable situation to treat on. I went to the patient, gave an explanation about what was going on, but of course I didn't do my best because I was so afraid. And that's why I started checking how to give a bad news properly and how it works, how patients receive that kind of information. And I found some steps. For example, one of the best expressions, one of the best ways to start is give warning. You can say, I'm afraid your test results aren't very good. I'm sorry to have to tell you that the news isn't good. That's the best way to introduce a bad news. That's the way to start giving an information that maybe is not that the patient is expecting on. You can say another one. You can give more explanations. But for giving that explanations, you cannot give this information in a wide place or a place with lots of people. You have to follow this. For example, choose an appropriate setting and have a friend or relative or a patient present. Have someone that can support the patient feelings when you finish this speech in an appropriate place. Of course, it's not an appropriate place with the rest of the patients, right? Take time. Don't go give the information as fast as you can and leave the patient. Of course not. Patients need time to understand how bad is the situation. Using appropriate language. I mean lay terms, non-medical terms. Terms that patients would understand without mixing ideas or missing information. When you catch this point, you must emphasize the positive. There's still a lot we can do to help you if there is a possibility. For example, chemotherapy will make you more comfortable. Could be. And you should, of course, discuss the prognosis with the patient, not relatives, with the patient. The patient is interested one on this. One can never be certain about these things, but I'd say it's a matter of months rather than days. It's better to stay in months than stay in days, right? We don't know how it works. Sometimes books can give us an answer, but the real situation is different. It depends on every patient, right? we can supplement the verbal message. For example, I'd like to record these consultations so you can listen again if anything is not clear. We can record all of this speech, and according to that, you can hear this and realize the proper information in the best way it works. Arrange a follow-up session. Okay, when you finish the information, patients go home or stay in the hospital and you go away, you certainly need a second interview to follow up, the follow-up session, okay? You can say, I'd like you to see again next week, or can you come in again next week, according to the situation, of course. Then you must be clear on this. You have to confirm that the patient understands all the situation, all the information. Is everything clear to you? Or do you understand all of this situation? Do you catch all of this situation properly? If they tell you yes, invite the patient to make a resume of the situation. And if they forget something, clarify the idea, okay? A consultant medical oncologist report, well, this is just a slide showing you specific vocabulary in Black and words. And please read this, it's just extra information, but we have to consider a specific vocabulary. Disappointed with, for example, or remain positive, or well tolerated, or refer or keen for, okay? Check this. Tomorrow I'm going to ask from this slide too, and I'm gonna show you a specific protocol about giving menus. So don't stop when you are tired. Stop when you are done. Okay? Follow your results, make your best, and catch as much information as you got in the best way. Okay, people, that's the class for today. Let me send you the poll to take attendance, please. And I'm gonna upload the slides to the chat. Okay, give me a second. Okay, just because I sent the slides to the Zoom chat, in order to download it, if someone couldn't open the file or someone couldn't get it into the group, okay? As you know, this is the last week we are going to work together. Tomorrow is the last workshop. And maybe you are asking yourself why I didn't send the writing exercise. Well, certainly I didn't do that because I just received one homework file. And well, with one student working and rest of the people doing anything, well, it's out of objective. On the other hand, I was asking for sending me your files by WhatsApp during the weekend, but nobody did it. I understand you are out of job, maybe. But well, that's why the writing exercise, I decided to avoid it. I was expecting anything, I know, corrections, details. Well, some of you, well, we were working with examples, how to do it, or we were working on how to catch the information, but well, anyway. So in the final test, I'm not gonna add a writing question, but I'm gonna add some extra questions. I mean, I'm gonna exchange questions in order to realize that you are catching the information from slides because you got it with time. So I hope it's gonna be a good decision for me. But well, patience. Don't forget that tomorrow we got the last workshop. And well, that's all. So everything is done. I think this class is completely done. Okay, thank you, Alejandra. Have a great night too. See you tomorrow.
See you tomorrow, doctor.
See ya. Bye-bye. Have a great night.